Eating and drinking is a social, cultural, and life-sustaining activity that is critical to healthy living. Many stroke survivors face challenges to eating and drinking safely. You play an important role in identifying problems, preventing complications, and improving the quality of life for those in your care. A stroke can damage the part of the brain that controls muscles in the lips, tongue, throat, and chest. These are the muscles used to chew and swallow, which, if damaged, can make eating and drinking unsafe. Difficulty or discomfort in swallowing is called dysphagia. Dysphagia affects over 1/3 of stroke survivors. Recommended stroke best practices are that all stroke survivors be screened for swallowing difficulties before taking anything by mouth. Persons who fail this screening will have had a thorough swallowing assessment by a speech-language pathologist. It is important for you to know the recommendations from that assessment. These could include modifications to food texture and/or recommendations for safe swallowing strategies. Caregivers like you should be aware of the risk factors related to dysphagia, able to identify the signs and symptoms of dysphagia, knowledgeable in applying appropriate care interventions to prevent complications related to dysphagia. If left undetected, dysphagia can lead to serious health risks, including dehydration, malnutrition, and aspiration pneumonia. Aspiration pneumonia can occur when food, liquids, saliva, or vomit enters the lungs. When providing care, several things can indicate someone is having difficulty swallowing. It is critical for you to be on the lookout for difficulty chewing, the sensation of food sticking in the throat, holding of food in the mouth, pocketing of food in cheeks or under the tongue, slow or uncoordinated swallowing, spillage of food from the mouth, coughing, choking, drooling, throat clearing, or change in voice quality such as wet or gurgly voice, or loss of voice after eating or drinking. To minimize the health risks associated with dysphagia, it is important for you to become familiar with the following safe feeding and swallowing strategies. Proper positioning and meal prep. Sit them in an upright position. Ensure they receive the recommended diet and texture. Cut food into small pieces and use smaller utensils as needed. Encourage them to stay upright for 30 minutes after meals. When working with someone who is tube-fed, be sure to consult with the care team for individualized positioning strategies. At mealtime, encourage them to eat slowly, not to talk when eating, feed themselves when possible versus being fed. Ensure their mouth is empty before taking in more food. Daily oral hygiene. Assist with the completion of regular oral hygiene care. This includes twice daily brushing and assistance in ensuring that the mouth is clear following meals. Regular dental care is very important for people with dysphagia. Always follow the food and diet instructions in the current care plan, and be sure to consult with your care team if you identify swallowing concerns or have any questions. There is no question that food plays a major role in life. This role does not lessen even if the ability to swallow, chew, digest, or absorb food is lost or changes. Using the feeding and swallowing strategies shown here will help ensure a safe and enjoyable eating experience for those in your care. If you have any questions, are interested in accessing additional resources or training opportunities, please visit our website.